most famous physical therapist on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I'll try to prove it to you today. Today we're going to talk about how to use a massage gun for shoulder pain. Now, when you're massaging your shoulder, you got to keep this in mind. There are a lot of muscles that attach directly to the shoulder and indirectly.
Right.
And they all can affect the position of the shoulder. The first ones we're going to talk about is the pectoralis major and minor here. You can see them.
Right there, those chest muscles.
Right. So here's the major, and underneath it is the minor. Now the major, it attaches right to the bone of the shoulder, the humerus.
The humerus, yep.
And it can actually turn that muscle in if it's tight. You very often see that where people are big weightlifters and they're got the arms and they're caved in chest because, it's
a little exaggerated maybe.
Now the pect minor actually attaches to the scapula.
Yeah.
So they can actually cause the scapula to be depressed.
Sure.
Not upset, but like
physically
down.
Downward.
So you may have to start by let's throw this one in here too, Brad. This is the latissimus dorsi, also attaches to the humerus and also can internally rotate.
It's that muscle that gives you the V shape.
You can see it right there, Brad.
Yep.
So, all right. So, what you do? So, we'll start with massaging these. Now, for the chest muscle, because there are ribs right underneath it, you're probably going to want to use a flatter head or maybe the air-filled head. So Brad's got the flatter head there.
Here's the air-filled one that would fit in here.
Yeah.
I've got a problem with mine right now, and I actually...
Which one do you use?
I use both.
Depends
on how tender my strain is. As it gets better, I go to the more aggressive flat one. Otherwise, I did start out with the airhead.
Sure. And you can feel it. I mean, obviously you can hear on my voice too, but I mean, the ribs are right underneath there, and there isn't a lot of space for air there. So generally, what you want to do is you want to go across the fibers if you can. So if you take a look here, you can actually see how the fibers are oriented. So here they're going like this way, and here they're going this way. So that's on the pec major. So it'd be nice to go across the fibers quite often. There you go, yep.
So, because when I do mine, I go at this direction, just like this. And
you're definitely heading across then.
Yeah. And there's quite a muscle belly at that point. So you can, I use the bigger gun with this, and it works well. You always can play with that and talk.
This is one of the smaller guns, but you really get a good handle on it.
Yep.
And it's also very powerful.
It is.
It's shockingly powerful. So.
Boy, this feels very good on that strain I have right now. I should quit, but.
So now I'm going to hit the latissimus. A little bit difficult to hit yourself.
Yeah.
You might have to have somebody help you. Now this muscle, you could, there's ribs there too. You're going to hit, if you get too aggressive with a pointer or something like a pointer attachment.
Bob, I've got a lot of mass. I think I got all muscle.
You got no problem hitting it,
But no, it's a little bit of a reach, but
and that's
doable.
where you might need somebody to give a helping hand.
Yep. Anything you get there on the back, it's just, if we had a longer arm and 3 elbows, it'd probably get to it. But
all right. So now those are a little more not directly to the shoulder. Let's talk some about that are going to directly affect the shoulder blade anyway, because the shoulder blade locks right into the shoulder and it can really play a large role. I'll get rid of this one. Another little toy. Let's go with this one right here. So, all right. Here is the shoulder. Let me get out of the way.
Yeah. There's Bob's body.
There's Bob's body. Here's the shoulder blade, but you can see how it attaches right to the shoulder. So if this is not stable, or if it's depressed, or if it's rotated, that's all a problem for your shoulder. That's going to throw off the mechanics of the shoulder, can cause impingement, all sorts of problems.
Yep.
So you can see 3 major muscles that attach to it. One is the big rhomboids here. So we got the big rhomboids here. Not rhomboids, trapezius.
Yeah.
Upper trapezius, middle trapezius,
Had me
lower
going
trapezius.
there.
Yep.
Yeah.
So over here is the rhomboids.
They're underneath the
Yep.
trapezius.
And here's the levator scapula, and that goes right up and attaches into the skull and the neck here. So actually you can affect your neck too.
Sure.
But
yeah.
so all of these muscles could use massage sometimes because they become tight and painful, and they also you might need some help sometimes
Right.
hitting those spots.
Yeah, especially in the backside,
Yeah.
obviously. Are you ready, Bob?
Yeah, go ahead. You can hit the upper trap if you want to.
Now I'm going to put the ball head on there because the ball, you don't have to go straight in with an
Right,
airhead.
you can
do.
get an angle on it.
Yeah,
then.
and that works pretty good. So I'm going to work that here. Now, big word of warning, especially with these guns, is you do not, by any means, want to go up to the neck. And be in
Right,
there.
absolutely.
It's too aggressive on the cervical spine.
There's not enough muscle there.
No.
It's just it just pounds the neck. And
Yeah,
it doesn't feel good.
That's a manual you do with your hands only. But boy, yeah, and I can work it down, and you'll know where to go because you'll feel the knots, you'll feel it. Woo. And then, of course, over the spine, the bumps, the spinous processes that go down, you're not going to want to go on that. Anytime, you don't want to massage with a gun over a bone.
Right.
Ooh. Actually, I can get pretty far down there, Bob. I'm kind of amazed. There is one option if you do happen to have this gun is the
Oh, right, the handheld massager.
yeah. It's not as powerful, but it does offer the option where you can get down here or this way and work it. So there we go. And it works okay. You can hear just by my voice that I'm getting percussion there.
Sure, and you can hit to your
Yep.
latissimus dorsi.
So
there,
if you don't have anybody at home to help you out, that might be the gun to get.
And you actually have somewhat tight shoulders, so.
I do.
Yeah,
I've been a tight shoulder person, Bob.
All right. How about the rotator cuff itself? So you've heard about the rotator cuff for years, I'm sure. Some people call it the rotator cup, right?
Yeah.
But it's cuff. And so this is coming from the back here. So Brad, yeah, right there. So we're looking at the muscles of the shoulder blade. The top one here, that's the supraspinatus. Then we got infraspinatus, and then we got teres minor. Oops, teres minor and teres major. But these three are part of the rotator cuff.
Sure.
And if you look underneath the scapula, which you can't, on the other side,
Yeah.
inside your body,
It's between the scapula
Yeah.
and the rib cage.
you have the subscapularis. So we're not going to be able to massage that one, but you certainly can massage these, the supraspinatus, infraspinatus, and the teres minor.
This bone right here,
Yeah.
you can always feel that on pretty much everyone unless you're
Yeah.
really a heavy person. But you want to avoid go below it or above it.
Right. So I'm going to hit right above it to start off with.
So that's the muscle that you get your impingement on the tendon, which is
Yeah.
over. But that's a good reason to
There's
massage
also a
that.
tendon right in here on these. I don't know how it is on you, Brad, but this is a good one to use the airhead because the bone is right there.
This one is
shoulder
pretty
blade.
nice because you can grab it so easily
Sure.
and get in there without too much effort.
You can definitely hit the teres minor and supraspinatus. Might be a little harder in infraspinatus.
As far as you're concerned, you don't have to worry which
You know,
muscle
the
you're
muscle
hitting.
you're
You
hitting,
don't have to know
right.
the names unless it really turns you on to
Yeah.
talk like that. But it just gives you the idea. There's a lot of muscles that do a lot of different mechanics of that shoulder. We need to soften them up, get them loose.
So you can see there's a lot of muscles that play a role in the shoulder. And
Sure.
the last one is the deltoid muscle.
So that's the superficial ones, and that's the more meaty one. That's
Yeah.
the one that gives power to that shoulder. They kind of complement the rotator cuff.
Right.
But there they
Help
are.
elevate too, and you can see there's the anterior. This is all the deltoid, but anterior, medial, and posterior deltoid.
Yep.
So that one's the easy one to hit.
Yeah.
That's certainly one you can really.
Getting to the back one's a little harder, but you can still do it. There. You're getting close to. There's a bone up here. Help me out, Bob. The bone right there.
The clavicle.
Yeah. No, the
Oh,
other one.
coracoid process. The
Mike, what is that?
coracoid process.
No, it's the bone where you get the impinges between the humerus.
Chromium.
That chromium. Man, that aging process is taking care of my memory. But yeah, just be careful. You're not going to go like right there. Ow, that's
right.
no good. You want to stay away from that.
Yeah, if you're going down to deltoid, the heavy part of the muscle, I got my vaccine and it's actually sore here yet, so I can't.
Well, you should massage it
Yeah,
a little bit.
maybe. It's a little bit hard there. So, anyway, you want to experiment around, but the recommendations we made for the heads are probably fairly good. Like the deltoid, you could probably even use a pointer because it's a pretty heavy muscle.
Probably fairly good. I think they're outstanding.
There we go. All right, remember this video is part of a series of videos on the use of the massage gun for whatever ails you. I mean, whatever, musculoskeletal.
Obviously, we're breaking down the body parts so you understand which muscles and why, if we say shoulder, we're having you work back here.
And which muscle attachment, which massage attachments to use.
Right.
Try to make them ready. So if you want to see the entire series, go to bobandbrad.com, go to the program section, and you'll find a whole bunch of programs there. We got sciatica, we got plantar fasciitis, and tens, and shoulder.
And then pick out, so you go to the massage gun one, pick out the one that pertains to you. You'll know by the title. Watch it. There's a button that says PDF printout. You get a printout reviewing the whole video, some details, highlights of it. And it's all for free.
Yeah.
We don't, not even your email.
Not an email.
It is a big deal.
We want good feelings coming our way, though.
I want to play with this, Bob. Watch
all
this.
Right.
Upside down.
All right.
It's a new toy.
Adios.